So thank you all for joining us today. We're here to discuss a very important topic for our community. It's one that we see every year, and I think this year is more important than the average year, and that topic, of course, is influenza. I'm joined by my colleagues, Dr. Michael Apostolakis, the Chief Medical Officer for Strong Memorial and for Highland Hospitals, to my left, and Dr. Robert Mayo, Chief Medical Officer for Rochester Regional, to my right. Last spring, Monroe County partnered with our hospital systems, both of our hospital systems, to quickly develop a unified response to what was then the start of the COVID-19 pandemic. We recognize the very critical importance of coming together to address what is a community problem. And today we are doing so again to face a different problem, but for the same reasons. Every year, thousands of Monroe County residents acquire the flu. And last year, over 750 of our local residents were hospitalized. The year prior to that, over 1,000. And the year prior to that, over 1,300 local Monroe County residents were hospitalized with the flu. Every flu season, our healthcare systems are strained. Imagine what it might be like if we have a second surge of COVID-19 here in our community. I cannot thank the members of our community enough for everything that you all have done together to fight COVID-19 here in Monroe County. It has been long, it has been hard, you have come together, and today we have the lowest number of active cases since April 1st. You all are wearing your masks, you're remaining physically distant, you're washing your hands, you're staying home when you're sick. These will all remain very important, both for influenza as well as it was for COVID-19. And fortunately, there is yet one more way we can all come together and take our precautions. And that way is to get your flu shot. It's easy. Just about everybody can do it. It's low cost. It might even be free. So get your flu shot. We know that every year only about half of our community gets the flu shot. And I do believe that in light of the challenges before us, I think this year we can do even better. So with that, I would like to now invite Dr. Apostolakis and Dr. Mayo to share a few words from the perspective of the healthcare systems.
I'd like to thank Dr. Mendoza and the Health Department and the media for this opportunity. This is an unprecedented time where we're now coming into a flu season on top of a viral pandemic. The flu, we sometimes forget, generally causes in the neighborhood of 10 to 60,000 deaths in the United States a year. That's from the Centers for Disease Control. And as you all know, we're now over 200,000 deaths from COVID in the United States. Our community, as Dr. Mendoza said, has done a great job of flattening the curve for COVID. I can't be more proud of our community and to live here and to be a healthcare provider here. But we need to keep a close eye on what we're doing and keep vigilant. With schools resuming, with businesses opening, and now with winter coming, we'll be closer together. It's time that we double down on the masking and the social distancing. As most of you know, the symptoms of flu and COVID are very similar, and it's going to be hard to tell the difference. And the less disease we have, the easier it'll be to care for patients and the community as a whole. The good news is preventing both of them is done similarly. Masking, social distancing, and good hand hygiene take care of both. And I'm very hopeful to continue those. We will see in our area very similar results of what we're seeing in some areas in the Southern Hemisphere, where the flu seasons have been quite mild. But we don't know that. In some areas in the Southern Hemisphere, that's not the case. And that's why it's important that we all get our flu vaccine. I got mine already. It's time to get it. It will last the entire season. This works and is very effective against the flu, and I've received some questions about what if there's a COVID vaccine? Will I be able to take it? Yes, when a COVID vaccine is available, having the flu vaccine will not be a contraindication or not make you unable to take the COVID vaccine. Now, as far as the flu vaccine goes, UR Medicine, like Rochester Regional, is not having flu clinics this year. We want to avoid the problems with physical distancing with patients lining up to get them. However, there are many places in the community to get your flu vaccine. Convenient and safe are the flu vaccine in many supermarkets and local pharmacies. In order to find the closest place to where you live, please check our website, fluvaccine.urmc.edu. In addition to information about the flu, you can enter your zip code and find close spots to get your flu vaccine. Finally, I just want to reiterate what a great job this community's done in lowering the cases of COVID. I know people are feeling mask fatigue, and we miss close contact. But we need to stay vigilant. We need to continue to save lives and continue to fight this. Hopefully soon we'll have a vaccine, and the community will continue to be able to open up, as will the rest of the nation. But we're not there yet, and let's continue to do all the good work we've been doing to keep each other safe and save lives. Thank you. I'd now like to introduce Dr. Rob Mayo.
Good afternoon. It's a pleasure for me to be here with you today with my colleagues, Drs. Mendoza and Apostolakis, with members of the media, and with the public who will be receiving this message. I fully concur and support the statements which I have heard from my colleagues. Rochester Regional Health is similarly concerned about the importance of getting the message out to the public about the flu vaccination. Each year within Rochester Regional Health, the employee flu vaccination campaigns achieve over 90% participation and compliance among the healthcare workers. And so we would love to see our community also reach much higher percentage participation rates in receiving the vaccine. The importance of this has been mentioned already, but vaccination saves lives. It also reduces the draw and the burden on healthcare resources. As we're all aware, much of the COVID-19 pandemic crisis was the overwhelming of healthcare systems. And if we can keep our community healthier and avoid illness, we can better manage the distribution of healthcare resources for the common baseline illnesses that we are treating on a day in and day out basis. So this is a really important point, that managing our resources is important. And we have done that this past summer. We have shown that we can do that, and I am confident and hopeful that we can continue to do that. So thank you very much.
Open up to questions now. We'll have to do a little shuffling if you know who you want up there to say the name.
How about the availability of flu vaccine? Early in COVID, there were problems with testing in minority communities, and the communities felt very left behind on this. What's being done from the county level to make sure that those communities that felt neglected in COVID have easy, ready access to flu vaccine?
Well, we're fortunate right now because we have all of the COVID work ongoing, and that has paved the way for us to access communities that we traditionally have not done a very good job with. And so the conversations around testing have been ongoing in parts of our city that have been traditionally underserved, and we're going to utilize the same avenues to offer flu vaccine to the same communities, churches. We have a number of events that are planned, so we're definitely working on that.
So the fact that the university isn't going to have flu clinic, is the county still having its school clinics?
So, this is coming up now with schools. We are not able to do immunization clinics in the traditional way for the same reasons that our healthcare systems can't, because we can't accommodate large walk-in, clinics for physical distancing purposes. So we're actually opening an extra clinic this coming Monday for immunizations, largely targeting the school population, children in schools, because we know the city school district has their 14-day deadline coming up, I think, on the 28th. But as far as influenza, it's going to be a different year. So we're going to be relying on our pharmacies. We're going to be relying on our healthcare providers, primary care offices, who provide the vast majority of flu shots in our community in any given year. We know that they're prepared, and thankfully we have no signs of any shortages yet of the main flu vaccine.
I have a question for the health systems, please. I know we talked about we're hoping how it's not a bad flu season because we're wearing masks, because we're social distancing, but if it is, can you talk about the plans that you're putting into place to make sure that you can handle it?
Thank you for that question. Such an important one that's all on our minds. So for the last couple of months, Rochester Regional Health has been developing a very rigorous integrated plan that we're calling our Wave 2 plan. And this is a plan that is built off many of the learnings from the earlier months of this year when we were encountering much higher COVID cases. And this plan is also informed by past flu seasons. And so we are integrating that information, creating a plan so that we can flex our clinical spaces, we can adapt our staff, potentially redeploy staff. We have had retraining programs to expand staff's competencies since the early part of the year, which we are continuing. And so there are many different facets to this plan. And I'm pleased with the completeness of it and feel that we will be able to serve the community at a time of crisis such as that.
Yeah, that's a great question. Similarly, what we've been doing at URMC, and the one silver lining about the COVID pandemic is that it's not only allowed us to prepare for viral pandemics, but actually prepare for the flu season. We expect to see more viral patients, and we will use similar plans to what we did for the viral pandemic. We have areas staked out to place more ventilators. We have the nursing staff in order to take care of more patients on ventilators, and we have a plan in place of how we would limit elective procedures and surgeries in order to make room for patients. However, based on what we've seen through the COVID pandemic, I am very comfortable in that I believe that our community will continue to do what they've done to protect themselves, their families, and patients from getting viral infections with the social distancing, the masking, and the hand washing. And I'm hopeful that we won't see a marked rise in cases of viral illness leading to hospitalization. But we are prepared for it.
There seems to be every year a certain number of people who don't, for whatever reason, want to get the flu shot. And we've had that discussion in our newsroom. What would be your advice to them?
Well, my advice is, unless you're one of the rare patients that's had a very significant reaction to the flu vaccine, life-threatening reaction or severe neurologic deterioration, that you reconsider and not only think about protecting yourself, but protecting your loved ones, the people you live with, any elderly persons you may come in contact with, or immunosuppressed you may come in contact with. So if not for yourself, do it for your family, your friends, and the other people you come in contact with. I'm very hopeful that we'll see some of the highest rates of immunization that we've ever seen in the community. The way it's pulled together for the COVID pandemic, I'm very hopeful we'll pull together for this viral influenza season.
Do you think that could lead to a shortage of
My understanding is that the supply of flu vaccine is quite good this year, and I don't anticipate any shortages.
The governor had asked counties for a plan on how they would be testing for both flu and COVID. I'm assuming you have had those discussions in the hospital systems. Do you have the capacity to be testing for both of these at the same time?
We're working on those plans right now, and we will be testing, and I don't want to speak for RH, but I've had these discussions with Dr. Mayo, and both systems will be testing for both viruses in the flu season to rule out one or the other and or diagnose co-infection, because both viruses can infect at the same time. So we are preparing to do just that.
Will there be more testing? I know often in past years, once flu season arrived, there was not a lot more testing. If you presented symptoms, you were assumed to have flu. Is that going to change this year and bring more people just with regular flu symptoms still be tested just to make sure?
Yes, there will, in my opinion, definitely be more testing, because we will be testing symptomatic patients with symptoms of flu or COVID for both.
Do you want to speak to this at all?
And it's one test, right? Okay, one test for both?
It will be one swab that will be used for both, to look for both infections.
Dr. Mendoza, can we ask you the back-to-school question? Yeah.
Do you want to do those now, or do you?
Are we done with flu questions? We're done with flu? We can go off topic.
Sure.
Okay.
We're seeing cases pop up. We're seeing classrooms close now in West Arundecoit today. Just kind of your feel for how it's going so far. Is this what you expected? And, what are these communications with the district?
We never expected that we would see zero. So we expected that we would see some. The first week or so, we were seeing cases that were acquired outside of school before school began. And yesterday was our first example of what we believe is a first transmission that could have happened in school. So by and large, though, we're looking at relatively small numbers compared to how other communities who have reopened their schools have gone. And I think that's a tribute to our having had a low prevalence going in to school. So all of what we're seeing so far so good. We're working very hard. Our communications with the schools has been facilitated by the fact that we've built relationships with all of them for the last several months. So we're all on a first-name texting basis at this point, and a lot of texts go back and forth. So.
Are you getting a call every time anyone gets a positive in any district?
Pretty much.
Yeah.
Do you want to see sports, high school sports back?
I would love to see sports. But we want to see sports happen safely. We do not want to be responsible for opening sports prematurely. So some sports are open, some sports are opening. There's a lot of conversation. In fact, I think I'm going to be meeting with the athletic directors from all of the high school districts in the coming weeks to talk through what that looks like. Fall is sports time for a lot of families, and we've got kids in sports, and we long for the days to sit in the bleachers with our coffee and our cold weather gear and watch sports, but we're not looking at that right now. But we would love to see that. But from my standpoint, the most important thing we do is keep our kids healthy and safe, and that we don't undermine any chances to have continued progress going into the winter and the spring. As you know, many of the seasons are being postponed, and we don't want to derail ourselves from that, because even that is going to be a major change for a lot of families. We don't want to do anything to jeopardize what will already be an abbreviated experience.
But what would be your threshold that thinking that maybe sports is contributing to increase in cases? And again, going into flu, I imagine you don't want to let anything get out of hand here.
Absolutely right. And well, so first of all, let's just say that the way we approach sports will be somewhat different than how we approach schools, because sports can be very regional. Insofar as a school might be a district or several buildings, when you're looking at teams playing one another, these teams may be coming from different parts of the region, crossing county lines, and so we're having to coordinate quite a bit. As far as the thresholds go, we'll apply the same science that we've been using all along. We know that outdoor sports will likely be much more safe than indoor sports. But as we gain experience, we're learning. We're learning about things now that we didn't know about 4 months ago. And so we'll have to continually reapply what we know, and it's really a dynamic process going forward.
So we're hearing from some parents, specifically in hybrid learning districts right now, saying that if their child is sick and they have to call in, they have to fill out a form and explain why. And with that, some parents have been telling me that even though their child has just allergies, ragweed season, non-COVID related symptoms, that the schools are telling them, well, you know, you have to have the test unless you have a note from your allergist saying that those symptoms are related to the allergies, and then they can't get in to see their allergist till a month later. So then the child ends up losing school for a week because they have to do an initial telemedicine appointment. They have to go get the testing, then they have to wait for the results. And so some parents are just a little frustrated. So I guess my question about that is, what are your thoughts on that? And relating to the flu, is there a fear that that's going to get worse and we're going to have more children missing school because of other symptoms that now maybe it might be the flu or COVID, and we're scared of both?
Well, let's first remember the most important way we keep our schools and our staff safe is by staying home if we're sick. That is by far the most important intervention that we can take home. And the last thing we want to do is send somebody into school prematurely. As much as we all want to get back, you know, one misstep could really sink it for a whole classroom. So with regard to returning to school from COVID, it is currently a requirement that you have a negative test for COVID and a note from a healthcare provider. It doesn't have to be a specialist. In fact, I don't think it should be a specialist in most cases, because the primary care doctor is likely to know that patient the best. But you still need to have both. And so that is presenting challenges, no doubt. And I, as a physician, know that clinical judgment is important. And we also know that these symptoms can mimic one another. So I think the better part of caution, unless there's a slam dunk case, which is rare, I think most of the time my colleagues will want to think very closely about whether COVID's present and test as appropriate.
Dr. Mendoza, with Western Underwood specifically, I believe they hold classes quarantine. One, do you think that was a good idea? And two, do you think their families should be staying home then with them?
I think it's a good idea because that was our recommendation. We recommended to that school district that they close that class because based on our investigation, we believe that there was a close contact interaction happening within that classroom. And so really out of an abundance of caution, we would want to quarantine that entire classroom, keep that class safe, and keep the rest of the school community safe. That's been our intention all along, is to, if we find something, nip it in the bud as soon as we can to keep everybody safe.
You say close contact. I know you and I have talked about this before. It was, if you're in close contact but with masks and social distancing, you didn't see the need for a classroom closure. So does that imply that maybe some of those things weren't being achieved? Well,
we have two cases in the same classroom. And so, I think the cautious assumption is that there was close contact. Because all along we've seen really no transmissions when close contact was observed, or when good precautions were observed, and all of the transmissions happening when that close contact was breached. So that's our assumption right now, and I think we're, I'd like to be, looking back on this and say we were too cautious. I'd be fine with that. I would much rather that than be too cavalier.
The question back to the flu with that. If I get the flu in November and recover, do I have any reason to be concerned about getting COVID again and potentially having more severe effects of it? I mean, I know the potential is probably there to get it, but should I be more concerned that my body's weakened?
Well, with any viral illness, the body takes some time to recover, to recuperate. But influenza and the SARS-CoV coronavirus are different viruses. So, getting either one are independent events of one another. And so where you are, relative to those infections will predict, your likelihood of recovery. So you should always be concerned. Even though you get influenza or COVID, there's always a chance of getting the other.
Are you confident testing this fall will be able to discern who has what?
Yeah, the testing for these viruses is relatively straightforward. It's very easy, once you've done the test appropriately and order it, to distinguish between the two.
The CDC really nailed people in the stomach with Halloween this week. Where do you stand on that? And what would be your message to the community locally?
So I believe, the CDC everybody's looking at the traditional house-to-house trick-or-treating as being the Halloween experience. They did a very good job underlying the other types of activities that we can engage in Halloween. And certainly those are worth considering, but I think what everybody wants to know is trick-or-treating. From my standpoint, I think, in this community, we're blessed by having a low prevalence rate. And so going into Halloween, I think there are ways that we can have trick-or-treating and do so safely. And so we're working on that guidance here in the community. But I do think that people ought to have the choice to opt in or to opt out. And I would certainly encourage those who are worried, people with chronic medical concerns, older individuals in the home, to probably want to opt out. But when you look at the types of interactions that happen in trick-or-treating, our kids are really racing from house to house. There aren't really any prolonged interactions between the kids and the homes. I think there are ways to, participate, wearing an actual mask, the face coverings that we've been recommending, in addition to whatever costume they might, those are the kinds of guidelines we're working on. But I do think that there are ways to do it and reduce the risk.
RIT has, with regard to the flu, has, and immunization vaccine, has put out a policy that if students aren't vaccinated by a certain time, that they can't circulate on campus. Your thoughts on that? Just, is that something that other local colleges should consider?
I mean, that is something that we're considering at the state level. And, there are pros and cons to that, of course. From a public health standpoint, this is a slam dunk. I would want everybody to be vaccinated. But, public health isn't the only perspective that we view things through as a society. And so we've got to think through the practicality of doing that, the desirability of doing that, the acceptability of that in various communities. And I think that's a conversation that's ongoing.
The RIT policy has it by spring, though. Isn't it too late by the spring semester?
For influenza?
Yeah.
I would say that's, we'd want to do it sooner than that.
We want to do it now, right?
I would rather now. I mean, every year the flu peak tends to happen in December and January. So, there's certainly no time that's too late, but you'd certainly get more benefit if we, had it sooner.
Is there
I'm sorry.
Is there optimal time for flu shot?
So we know that it takes about 10 to 14 days from when you get the shot to when you develop the protection from it. It's always a guessing game as to when that peak will happen. Every year is different. And this year, if any year was going to be different, it would be this year. But there is no evidence that it wears off at the end. And so what I'm recommending to my patients is get it now.
Back to the quarantine classroom. What if they have siblings that are going to school? What's their protocol?
The siblings of the people in the classroom.
In quarantine.
Right. So the people who are quarantined are people who we believe are at added risk through close contact. We won't quarantine, or we won't have any additional recommendations to the next sort of layer of people until anybody in that second layer turns out positive. So the sibling of a quarantined student can go to school.
Minimal risk?
The same risk as the day before. Yeah.
Patty, final question?
One of the members of the Rochester School Board the other night at the meeting talked about the low number of cases, thinking about reopening in Rochester. The superintendent said that it's something that they're looking at. They're probably halfway through that 10-week period. Is there something different about Rochester School District reopening that you're concerned with, having discussions with, different from some of the other, even larger districts in the county that may keep them going remote even longer, even with a low prevalence in the community?
From a risk standpoint, I don't see the city school as at any greater risk than any other school district. We all are a part of the same community. We all have a sufficiently low prevalence rate going into all of this. So I would think that there should be ways to reopen the city schools and manage the risk. We're learning, the city schools will now have a 10-week period where they've had the opportunity to learn from the other schools that have gone through this. And certainly the benefit is there. We want our city school kids to be benefiting from school. So I'd like to see the city schools open.
Okay, thank you. Thank you, everybody.
Thank you.
Thank you.